Okay, so I am recording. So we'll get going. We're waiting on a few more students, but hopefully they'll be here. Welcome to week 5. How's everybody doing? Doing okay?
Doing good.
Okay. Okay. I know it's busy. We're getting into the thick of things here in week 5 with this class and all the rest of your classes. The one thing I wanted to start out with is HESI Prep, your HESI Prep assignment. How are you guys coming on that? Have you guys been trying to complete it each couple of weeks so that you don't get stuck with a blank assignment on week 8? I know it's due in week 9, but the whole purpose of the HESI Prep assignment is it's an ongoing kind of a fill in as you go study guide. So when it comes to HESI in a month or so, it will be completed. Does that make sense? We talked about this in week 1. Okay. So how are you guys coming on your HESI Prep? Has anybody completed it, or has anybody been working on it as we go?
I've been working on it.
Okay. Okay.
Mine's completed.
Wow. Okay, great. Great. I really suggest that you don't wait till week 8 to complete this. Okay.
I got a
Because
question. Sorry. Are we allowed to submit it early? So we don't forget last minute?
yeah, of
Or do you
course,
want us to wait?
you can submit it whenever you want to submit it.
Okay, great. Thank you.
Sure. It's a pretty extensive assignment, and each week we cover different aspects of that HESI Prep assignment. So I would suggest you maybe go back and complete the sections that we've already covered, so that in week 8 you're not thinking, oh yeah, I remember covering that, but I forget which week we covered it. Okay. So that's my suggestion. And then the other thing is, please make sure you're using the HESI Prep that I sent in week 1. I can't stress that enough. Okay, in your week 1 announcement, I sent you the updated HESI Prep. Do not use the one from week 9. Do not use that link. It's a HESI Prep, but it's I wouldn't say outdated, but it has much more information on there than you need to be studying for the HESI. That's why I'm saying make sure you're using week 1, that attachment. And then after we get through our content here, I'll go ahead and open up quiz 3, and we'll take it together as a group. I had an issue with a student taking it early 2 weeks ago and ran into some problems, and you have to take the quiz during class. That shows your attendance. So anyway, that's why I closed out the quizzes, and we'll open them up during the week in which we give them. Okay. So we'll go through excuse me, weeks 4 and 5 content. Since you were taking an exam last week, we'll review week 4 and do week 5 as well. So there's quite a bit of information to cover here. Okay. What else did I want to tell you guys about? Oh, I sent out earlier the group assignments. Okay, for your week 7 group project. Okay, so if you haven't seen those, it's in your announcement. Alrighty. What questions do you guys have for me?
So
Sorry.
sorry. For the group assignments, you have us and like the people that are in the group, are we supposed to be reaching out to them or?
Yep, somebody needs to
So-
take the lead. You should have a list of emails in your shell of your teammates, of everybody in the class. So somebody can take the lead and send out a group email, or you're more than happy to put your put your contact information in the chat during class today so that you can reach out to each other. Okay, so somebody needs to take that lead and send out a group email and figure out how you want to progress through getting this group assignment done.
I don't see my name in the group assignment. This is Princess.
Yeah. Okay. For Monday, all right. Okay. Shoot, I double checked and let's see. Okay, you know what? Hang on, Princess, 1 second. Let's put you in. Let's put you in the Bravo group. Okay.
Okay, thank you.
Yep. Sorry about that.
Miss Marble, I
Yes.
wanna meet up with you because I wanna see what I missed on my test, even though it was a good grade, just so I know what to focus on moving forward.
Okay. So, who was just talking? Who was that?
Ileshka,
Oh, hey, just send me some days and times that would work for you, and we'll figure something out. Okay.
thank you.
You're welcome. And if anybody else, I didn't have many takers at all to review the exam. I think I had one from this class. I have a couple of reviews scheduled for next week with students, but if you want to review the exam, please let me know. Okay. Okay. Let's see. Allie's not here, is she? I don't have Allie, and I don't have Gouffran. I don't have those two students here. Okay, so let's get going with content. I'm going to pull up the notes that we reviewed, or that I sent last week for week 4 and this week for week 5. That's a good summary of all the information that was covered, all the readings that you should have done, or that you were responsible for doing. Okay, so let me share my screen. Okay, so last week, what we covered were special vulnerable populations. And the 4 that we consider special vulnerable populations are the pregnant adolescents, LGBTQ, mental illness, and alcohol, tobacco, and other drug problems, also known as ATOH. So the first 3, oops, let me let this student in. So the first 3, pregnant adolescent, LGBTQ, and mental illness, these 3 topics are all covered in your Canvas readings. Okay, so hopefully you found these by now, but I just want to go through it with you. Week 4. Okay, so your readings. So the alcohol, tobacco, and other drug information was found in chapter 48. Okay, and that should be on your syllabus, chapter 48, substance abuse. And then pregnant adolescents, LGBTQ, and mental illness are all covered in your Canvas readings. So that's where you need to be going for that information. Okay, and then we're going to review just a summary of the information covered. Okay, so here in your week 4 notes, I've put out where your All right, so chapter 48, care of the patients with substance-related and addictive disorders. That's your alcohol, tobacco, and other drug problem. Okay. So, teen pregnancy. Anybody work with this population? Why do we think this is considered a special vulnerable population? Why is this group vulnerable?
The age for one, lack of education,
Mhm.
Low
understanding,
income, lack of
peer
social
pressure,
support,
drugs.
environment exposures.
Yeah. Anybody else? Well, we do know what this
They're
group.
also at risk for physical
Go ahead.
complications.
Race.
Aren't they still growing too? They're still developing.
Rachel, what did you say?
Just that they're at risk for physical complications with their pregnancy because their bodies aren't ready yet.
Mhm. Mhm. We do know that racial and ethnic minority groups have a higher rate of teen pregnancies. Okay, because that particular group also has higher rates of poverty, reduced or lack of education or reduced educational opportunities. This group is also very susceptible to higher rates of abuse, violence, sexual victimization, right? What are some factors that contribute to teen pregnancy? What do you think? Low income, right? Lack of education, especially lack of social support networks. Maybe living,
Condoms, protection.
pardon me?
I said condoms, protection, birth control.
And then certainly
Poor
environmental,
education also.
poor education, absolutely.
On conception, yep.
Mhm. And then there's certain living environment exposures, abuse, trauma, neglect, right? The one thing we have to remember about teen pregnant population is they're very likely to be present oriented. What does that mean? Versus future oriented. What does that mean?
Living in the
Just living in
now.
a moment.
Just doing things on a whim, just doing it just because.
Being in a moment and not planning for the future.
Exactly. Exactly. Yeah. We also know that adolescents are less likely to use birth control the first time they have sex. Right? They don't have a clue typically how to access reproductive health services. Right? That they think they need to be a parent. They may not even know how to buy condoms or access other contraception. And we do know specifically about this population that they have high rates of substance abuse and risky behavior, right? Typically teens who get pregnant are typically caught up in the cycle of poverty and school failure and have a much higher risk of becoming homeless. And another unfavorable statistic is that they are more at risk to experience violence during their pregnancies. They're also more likely to abuse substances during and after their pregnancy as well. Okay. Here's some examples of primary, secondary, and tertiary levels of intervention with this particular group. Well, you give me some. What would be some examples of primary prevention with regards to
Being a
this?
teen mom, I want to say that in the midst of me being a teen mom, they didn't have education, sexual education in school, or nothing like that to prevent it. So stepping into it, it was like I didn't have the education, but I wouldn't say that I abused substances or nothing like that. Like, I don't know. being a teen mom and hearing the statistics is different, you know? But I do agree that the environment that you live in does affect how you come out and what you develop and what you get out of it, I guess.
Right. Yep. Thank you for sharing, Kadisha. For primary prevention, we're trying to prevent the event, right? With this group, trying to prevent the pregnancy. So one of the biggest primary interventions is education, sex education, right? The sooner the better, right? The sooner the education, the lower the risk of unintended pregnancies and STDs. And like Kadisha said, many schools don't do their sex education programs anymore. All right. And
Yeah, because it's an uncomfortable conversation. A lot of people don't like to have those uncomfortable conversations either.
absolutely. Absolutely. Right. So who is it left up to try and fill in that gap? Parents or relatives. Right. Secondary. So secondary is early intervention, early identification, screening. So what are we trying to do? We're trying to identify who are our high risk adolescents, right? Who might have a history of substance abuse, history of sexual, physical, or emotional abuse, living in poverty, who's vulnerable, right? We want to provide screening, pregnancy screening, STD screening, contraception, right? So screening is all about trying to identify your high-risk groups early on, okay? Tertiary, they're now pregnant, right? So then we move our focus as nurses into counseling or advocacy. Okay, what are the immediate concerns? Does she possibly want an abortion? Does she want to talk about adoption? Does she want to talk about going back to school? Does she have any kind of support network? What's the priority of needs with this particular teen? And then we need to talk about nutrition, right? Nutritionally, what does she need? She needs folic acid and iron. You guys have taken OB, right? Okay. Is she going to go back to school? Okay. One of the most important aspects of teen pregnancy is trying to keep these kids in school, right? The more education they can get, the better they're going to be prepared to make better life choices. Would you guys agree?
Professor Marvel, I know they always talk about, it seemed like they're always associating teen pregnancy with poverty.
Mm-hmm.
But you also, let me see, I don't know how to say this without being judgmental, but I will say in other racial groups, you have teen pregnancies, but they do have abortions, or they do, they have the money for them to have an abortion so that they can, they let them know, you're not going to ruin your life, you're going to go to school, this and that or another. But it seemed like it's always like, they always put the teen pregnancy on poverty. And it's not more so teen pregnancy and poverty. You have it in medium income or whatever, but it's just that they have the money to pay for abortions and stuff.
That's an excellent point.
It happens, but I mean, it just seems like they always associate poverty with a certain race and like education, pregnancy and poverty. It's like, that's just always on the forefront.
Mhm. Yeah, that's an excellent point. I mean, obviously, teen pregnancy can happen with any race, right? At any income level, with a number of support systems in place. However, um, it's how do I say this? It's more prevalent. It's more prevalent in the populations we just discussed. So yes, it happens everywhere. It's just more prevalent. Poverty is more prevalent with the number of teen pregnancies. Not all, certainly not all. But thank you for bringing that up. That's another point of view, really important. Okay, also with teen mothers, they struggle to bond, right? So when, let's say you're a home health nurse or a community nurse that's working with new teen mothers, one of the things you want to observe is their ability to bond. Are they holding the baby? Can they identify what the baby's needs are when the baby's crying? Do they feed the baby appropriately? Making eye contact, talking to the baby, really important, because this is an issue, specifically with teen pregnancy. Okay. With regards to mental illness, what are your thoughts on what are your thoughts on the current state of mental illness in our country? I'm just interested in your thoughts.
It seems like it's a
I
lot.
think it's sad. Oh, I'm sorry, go ahead.
I was just saying it's a lot now. I feel like it's gone up. Or maybe we're just looking at it a little closer.
Absolutely, and looking at it closer and seeing that the major depression depression leads to that mental illness is like crazy. Don't talk about like mental health and things like that, you know?
Mhm.
So that was like, wow.
Yeah, and what's happened over the last 3 years with the pandemic?
People committing suicide, killing other people.
Yeah.
Can't
I
cope
saw-
with life.
People struggling even more with the inflation and can't pay their bills and things like that, losing their job or jobs not being available too.
Absolutely. Yeah. I saw this firsthand in the schools when I worked in the schools during the pandemic. I saw it with students and I saw it with parents. The mental illness, the skyrocketed. And they were also much younger students. Okay, from isolation, from social isolation, trying to learn online, not being able to see their friends. And then parents losing their jobs or having to quit their jobs to stay home. Mental illness has exploded in the last several years, exploded at all ages, with all ethnicities, and of all backgrounds. Suicide rates have jumped, especially in kids. Okay, so we know that mental illness can occur at any point across the lifespan. Okay, and like Kadisha said, depression. Depression is the leading cause of disability in the US. We know that Alzheimer's has been rising consistently. Okay, it's estimated that over 10 million adults have a serious mental illness, leading to a significant disruption in their daily living. Right, mental illness is generally more severe, especially when there's a coexisting, say, addiction or substance abuse problem. mental illness also is associated with physical disabilities. I mean, think about it. If you have 10 people, 10 million people that are suffering from serious mental illness, these could be your family members, your relatives, your friends, your coworkers, your neighbors. I mean, it seems like every single day, all throughout the day, we're hearing of these awful, awful, awful tragedies. And when when you start to report on them and the people who have committed these heinous acts, it goes back to mental illness, untreated mental illnesses. And as we've talked about, your worsening or poor life circumstances make you more vulnerable with little to no family or social support, truly leads to different kinds of mental illnesses. Okay. Back in the day, you guys are probably too young to remember this, but there was a lot of healthcare reform back in the day with regards to mental health. Okay. There used to be institutions for mentally ill patients. Well, we moved to a deinstitutionalized society, which meant the release of many, many severely ill individuals into the community. Right? There's attempts all the time to try and help them and humanize them and improve their quality of life. And the population I think about most is the homeless. But unfortunately, many of these very, very mentally ill clients are just unable to get the help that they need. I mean, we all probably know somebody. I do. A couple of people that are really, really have serious mental illnesses, and the lack of support and resources. People are trying, but there's so few, not enough to treat what we have going on currently. Okay. So mental illness is a really, really, really big issue. And then think about children. And like I said, I saw this firsthand. In all vulnerability, all right, in all the vulnerability of mental illness, children are at highest risk for mental disorders. And look at what these kids see today. Increase in poverty, witnessing violence, being victims themselves, friends committing suicide. And for purposes of this class, in public health, the United States really has still a very long way to go in caring for people with mental illnesses. And then you add in a client with mental illness who also has the comorbidity of a substance abuse. Typically, these people, these clients, end up somewhere in the criminal justice system.
And it
And
could
we-
be that they're going to the substance because the medication is taking so long to kick in, because that type of medication takes about 3 to 4 weeks to actually get its effect. For mental illnesses.
Mhm. But you know what, Khadisha, there's no plan in the interim.
Right.
You know, you're absolutely right. What about the vulnerable populations that have with mental illness that don't have any insurance,
Right.
and don't even have a provider, and they don't even have medication.
Mhm.
It's really, really, really sad.
It is.
It's very sad. The
I think
state
too-
of the state of our clients with, I mean, think of all of our vulnerable populations we talk about in this class. A lot of the underlying issues are mental illness.
Right.
And then we talk about ATOD stands for alcohol, tobacco, and other drugs. Okay. We know that alcohol and tobacco are major drugs of abuse when we discuss substance abuse, drug addiction, chemical dependency. Okay, we know that substance abuse contributes to teen pregnancy, HIV, STDs, domestic violence, child abuse, domestic abuse, motor vehicle crashes, fights, crime, homicides, suicides, right? Like mental illness, think about the, what was the statistic for 2022? I think it was 107,000 overdoses in just this country alone. And that's unbelievable numbers. And it's increasing year after year. We know that tobacco, still a major problem, although better, contributes to cancer, heart disease, lung disease, bronchitis, respiratory issues. And we know that smoking also contributes to, for pregnant moms, women, contributes to premature birth, low birth weight. Okay. Some contributing factors to substance abuse. Okay. A person's current health may alter the drug's effect from one day to the next. Some people are genetically predisposed to alcoholism or drug addiction, right? And their chemical makeup is such that simply consuming the alcohol, the drugs, triggers the disease. What about the clients with underlying mood disorders, or may have a mental illness? They may try and self-medicate, right? And sometimes what they're using exacerbates their symptoms, right? An example we give is a depressed person might consume alcohol and become more depressed. That's pretty common. What about the environment? The influence, the physical influence, the social influence, the cultural influence, right? And we definitely would probably all agree that social conditions influence the use of drugs. If you talk to any, I participated or taught a drug prevention class at the high school level when I was in the schools. Overwhelmingly, when you ask these kids why they started smoking or why they started drinking or why they start, it comes down to peer pressure, where that was a major reason. Everybody else is doing it, so why not me? And then look at the advertising. The advertising from pharmaceutical companies, alcohol companies, tobacco companies. They're enticing this younger generation or younger people to use their products, right? This information with ATOH is, like I said, chapter 48. Okay. Here's some terms and definitions that I want you to be familiar with. Okay. I'm going to have you read through these, but please be familiar with these terms. You're going to be asked about this on your next exam. Okay, what's substance abuse? What's drug dependence? What's drug addiction? What's the difference between dependence and addiction? What's alcoholism? Okay. And then be familiar with the different kinds of drugs. Okay, we have psychoactive drugs, which include depressants, stimulants, energy drinks. Okay. Okay, and then here's some information about nicotine and tobacco, vaping. If you go in to do a visit and you're working with a family that is a smoking family, smoking house, and they have kids, pardon me, oh, younger kids with asthma, and you're teaching them, your goal is to have a smoke-free house. Let's say you get asked a question that goes something like this. After you've finished your education about the dangers and risks of smoking with asthmatic children, the parent states, which of the following does the parent state to you that you know that they didn't hear you or they need more education? What might a parent say?
I switched to vaping.
I was gonna say,
Alishka, good job.
wasn't that on our exam? I remember that
I
question.
don't
Yes,
know.
I remember the question. That's why I was like,
Yeah.
yeah.
Okay,
I don't know. I don't know.
I remember that.
Okay. Right? So what if a parent says, I switched to vaping? Is that okay?
No, because it's still
Apparently
harmful.
not.
Exactly. Exactly. Okay. Alcohol, you can read about that. And then we're still under psychoactive drugs, so cocaine. Okay, amphetamines, methamphetamines. One of the biggest challenges for us as nurses when it comes to alcohol and drug abuse is we want to focus on harm reduction. What's harm reduction? Think about it. If
You
you're
want to stop the harm coming from you,
Mhm,
coming to you by using illegal substances.
mhm. Harm reduction refers to focusing on health promotion and disease prevention. Think about it. You're trying to reduce the harm. Okay, so some examples of primary prevention for the alcohol and drug potential drug would be the promotion of healthy lifestyles, resiliency. Like Pamela said, try and stop it before it even starts. Right? Focus on teaching about healthy lifestyles, resiliency, maybe education about drugs and guidelines for their use. We know that we can be effective teachers, right? We know that one of our jobs is to promote and facilitate people choosing healthy options rather than relying on drugs, right? We also know that lack of educational opportunities, job training, or both contribute to socioeconomic stress, poor self-esteem, which can lead to drug use, right? To try and escape a situation. We as community nurses can help identify what resources are available in communities to help these clients. What's resiliency?
Just to never give up, but just keep trying.
Okay, so that's another one of our tasks, is to try and increase resiliency with these clients. What happens if you increase their resiliency? Does their risk go up or their risk go down?
The risk goes down.
Absolutely. Absolutely. So how do we teach resiliency? How do we model resiliency? How do we help our clients become more resilient? Maybe work with the parents. Go ahead, Kadisha.
I was just gonna say educate, let them know, educate them on the things that they need to know. Community resources, social, economic resources, things that they can do in the community to help them out, and just things like that.
Mhm.
Improve their knowledge so
Mhm.
they'll know more and do more, I guess.
Hey, yeah, that's what I want to cover. And then you can, in your reading, the LGBTQ was not in the weekly notes, but in your, let's see, in your Canvas reading, it talks about LGBTQ population. And just a couple of things to mention about this population, right? First, you have to identify what your own feelings are, right? Because in order for you to be able to provide best practice care to this group, you must sort out your own feelings. Okay? We know that sexual orientation is how a person characterizes their sexual and emotional attraction to others. Okay? It's helpful to think of sexual orientation as consisting of 3 dimensions: behavior, attraction, and identity. Okay? What do we mean when we talk about gender identity? What does gender identity mean?
Male or female.
Okay? Anybody else want to expand on that?
I would say,
Is
well,
that like if you've been
Preference.
born a girl, but you feel like you're a boy or vice versa? That's what you identify with?
Exactly. Exactly, Tamu. It's a person's internal sense of being, whether they feel like they're a man or a male or a woman or a female or both or neither or another gender. Everyone has a gender identity. For most people, gender identity does correspond with their assigned sex at birth, right? However, we have transgender people, right? That their gender identities do not correspond with their sex at birth. Okay. So we have
This is kind of off the subject, maybe a little bit, but can I just ask you this? One of my, be quiet, Okito. I have a friend and her sister, she has 3 daughters and a son. And her first daughter, her firstborn was okay. But then she wanted a boy so bad in the second child. So this little girl, she went to the prom, did everything to, just what a little girls would do, but she just isn't, I don't know. It just seems like she was a boy. And her mom says she thinks because she wanted a boy so bad during her pregnancy or whatever, maybe that just came out. But this, like, she doesn't, you know how you have some people that are girls and they try to act like a boy, but this little girl is just truly just like a boy.
boy.
And then the little boy that she had, it's like he should have been a girl. You know, it's he and it's, you know, they try to say, well, that's because he was raised with 3 sisters or whatever, but
Mhm, mhm.
you try to put him into sports and do stuff or whatever, but it's almost like her kids, the boy should have been a girl, the girl should have been a boy.
Mm.
So is that possible that when people are pregnant, just, I mean, is it with the hormones or, because you know, some people try to identify with that other, but it just seems like it's natural for them. Like she never
You know,
wanted
what
to
I would,
dress
what I would
and stuff like
say,
that.
what I would say, Tamu, is every situation is different. Every situation is different, and you know, it's a interesting time to be talking about LGBTQ, right? You know, in the past, we would think about um, maybe a lesbian couple or a homosexual couple. And look at what it's evolved to, right? This area of this is evolved into areas that it just keeps expanding, I guess. The number of, you know, genders, the number of younger population that are transitioning. So I think every situation is unique. I've heard what you've said over and over again. I've heard that numerous times. And I would just say that every situation is unique, and you know, our role as nurses is to support the LGBTQ population because they too are a vulnerable population, right? So I would suggest you read through this page as well. Okay. Despite increasing social acceptance of this group, violence and victimization related to this group exists, right? Sexual minority high school students are more likely than their heterosexual counterparts to be threatened with violence or bullying or injured, right? And same with adults. And if you look at a lot of, again, negative stories in the news against this particular community, you know, there's a lot going on. There's a lot going on. Let's move into this week. Anybody read about this week? This week we talk about hospice and palliative care, death and dying, faith and spirituality, and ethics. What's the difference between hospice and palliative care?
Hospice is more so, well, they've redefined it, but it's like the end of life, and then palliative, you're not as intense with like medications and stuff. It's minimum.
Mhm, mhm.
Hospice is like keeping them comfortable.
What do you think the primary goal is for hospice clients? What do we want to do?
Keep them comfortable.
Exactly. Keep them comfortable, trying to alleviate as much suffering as possible. The one thing to remember about hospice is that we're not in any kind of position to cure. Gufran, are you driving? Pardon me?
Yeah, I'm sorry. I had to pick up my son.
Yeah, you can't be on while you're driving. So why
I'm
don't you-
gonna park somewhere.
Okay. We know we can't cure, right? For terminally ill, there's no cure, right? Our focus is on improving the quality of the remaining life, right? We try and help the clients accept that death is a normal part of life and is expected, and trying to humanize that experience. Okay, the goal for hospice is to focus on the quality of life rather than the quantity. Right? We're trying to help them manage their symptoms, trying to provide them psychological, emotional, spiritual support. Right? Has anybody worked with hospice, in hospice care, palliative care?
I have.
Yeah.
I haven't worked in it, but my dad was in palliative care.
Mm-hmm. Mm-hmm.
Yeah, he had passed away, but they wouldn't give him any medication because his blood pressure was really low.
Oh. Oh.
So
Mm. Um, a lot of times hospice care is provided in their patient for clients in their homes. It's also provided in long-term care facilities. Okay. And hospice, as we said, is for the end stage of life, right? Typically, the patient has a prognosis of no more than 6 months if all treatments were to be stopped. Okay. Nursing, what is our goal? Social support, psychological support, spiritual support, trying to improve the quality of life, try and reduce suffering, assisting with the grieving process. That's really important. Okay, for physical support, some of the things that happen are trying to alleviate pain, reduce air hunger, improve sleep. Social support, maybe try and facilitate relationships that may be strained or neglected, that the patient wants to mend, updating a will, saying goodbye. And spiritual support, finding peace with God or a higher power through a chaplain or a spiritual advisor. One of the things I need for you guys to be aware of and know about is what are the stages of grief. I just highlighted it in yellow. Be able to identify if you were given a scenario with a hospice patient or a family member and the client said something in a particular scenario, please be able to identify what stage of grief that would be in. Okay. Therapeutic communication in this process is critical as nurses. What is therapeutic communication? I know you've talked about this in other classes. What's therapeutic communication?
Looking them right in the eye, being respectful. Let me see, what else?
Not making assumptions.
Yeah,
Open
understanding, listening.
Mm-hmm. Mm-hmm. Mm-hmm.
Not necessarily providing answers, but being a platform for them to say what they need to say.
Right. Letting them tell their story, express their feelings. Right? This is not a time for us to be judgmental or unkind or trying to push our beliefs or values onto somebody, right? And the other thing too, that must be included with hospice care, palliative care, is the family. What do you do if what are you going to do if families don't agree on the plan of care? Who's the most important to
You
listen
gotta
to?
respect their wishes, even if you don't agree with them.
Exactly. Exactly. And especially if they have advanced directives. You know, we are required ethically to follow what, Alicia, are you driving too?
No, I'm a passenger right now.
Okay, okay. We are required to follow what their wishes are, the client, whether the family agrees or not. And the hospice nurses receive a lots of additional training on how to work with and education on how to work with families. What if you do if you have family members that are not supportive or not engaged or don't want to participate in the process? Well, we got to bring them all in. Our goal is to bring everybody together. What's a faith community nurse? Do you guys, I have two friends who are faith community nurses. Do you guys know what a faith community nurse is?
Is that like the
It's like
people
oriented,
like
Church.
community oriented.
Yeah. Faith community nurse is usually, I mean, depending on whatever kind of religion you practice, whether you practice in a church or a mosque or a temple, faith community nurse works with that congregation of whatever religion we're talking about. So they are a home health nurse, but what would you think they would add to their care if they're a faith community nurse? The spiritual side.
praying for the people?
Right, the spiritual side. Okay. Faith community nurses either work with the congregation itself, or they could partner with outside organizations to do transportation, do wound care, do PT, do OT. Faith community nurses are a very important part of a faith-based community. Okay, they may do home health visits, they may do new parent visits, they may do support groups, they may do grief counseling, they advocacy, finding resources for families in their congregation. Okay, so the most important thing is that the religious and spiritual beliefs of the client are taken into account as you plan care for them. Okay. Ethics. Okay. Why is ethics so critical in our nursing profession? What is ethics?
Beliefs. Beliefs. What people believe.
Mhm. What else? What else do you guys think of when you think of ethics? Doing what's morally right. Right? What would a group of your peers do at the same scenario? Okay. I would like for you to read the 3 pages in chapter 3. No, hang on. Where are your ethics? Chapter 3, pages 44 to 46. You are going to have some questions on the next exam regards to ethics. And I would also like for you to read this section of ethics on your week 5 notes. I want you to know about the ethical theories. Okay, if you prep for class, you should have already read about them. Okay, there's a couple of theories: principalism, utilitarianism. You're going to be given scenarios. You need to be able to pick what principle the scenario represents. Okay. So you need to read through the section on ethics as well. And the reason why I want to stop here is because I want to do our quiz. Okay. Let me go back and open up the quiz here. I just opened up the quiz. All right, so it's what time is it? 4 o'clock. Take 15 minutes to do the quiz, and then we'll spend the last 15 minutes of the class reviewing the quiz. Okay? So everybody, I want everybody to take the quiz now. And take your time. Take your time doing the quiz. You got 15 minutes. Okay, is everybody done? Okay, you get about 1 more minute, then we're gonna review the exam. And if you're done, make sure you hit submit. Let me take a peek here. See how we're all doing. Three students that haven't finished yet, Tyan, Angelique, and Lanisha. You guys getting close? Okay. You guys done? Tyan, you done? Angelique, you done? Lanisha, you done? Okay, all right. Okay, let's go through it. See how you did. I have it pulled. Oh, nope. Let me take that back. Let me share my screen. Okay, can you guys see that? Yes, no?
Yes.
Okay, let's talk about it. Okay, the school nurse is engaging in a primary prevention program. Which intervention is appropriate? Would you guys answer?
The ongoing discuss where and how to obtain ongoing contraceptions,
And why is that primary?
because you're trying to prevent them from getting pregnant.
Okay. What is A? Is A primary, secondary, or tertiary?
Secondary,
Thank you. Why is it secondary?
because you're screening them for pregnancy and it's already
Exactly.
done. Should have been prevented.
Okay, what's C? Primary, secondary, or tertiary?
That's tertiary, because they already have it.
Exactly. Exactly. Great. Okay. Number 2. Which counseling is appropriate to provide a pregnant adolescent?
Continue
Continue using condoms.
Okay. So A is the correct answer. Why is A the correct answer?
Because it's a preventive measure.
What
Prevention.
else?
Well, she's already pregnant, so you want her to, it's still prevention is the key word. She's,
Prevention.
damage is done, but you still wanna,
Mm-hmm.
another
STD.
scenario
Okay.
from.
B is the opposite, right? We do need modifications. Prenatal care can be established in the second trimester. Nope, we want prenatal care as early as possible, right? And then as far as adoption decisions being made as early as possible, That's not necessarily true. Right? So A is the correct answer. Number 3. Which intervention should be prioritized for a child who has witnessed a violent crime?
See,
Pardon me?
obtain the referral.
Mhm. Tell me why that's the right answer.
So that they can get
Well,
help.
oh, go ahead.
Go ahead.
If they've already witnessed it, if you're teaching stress,
Mhm.
and then assessing them, but you want to get them help.
Correct. That's exactly right, Tim. Good job. Obtain a referral, right? It's fine to teach stress reduction techniques prior to something like this happening, right? Yes, eventually, maybe you're going to assess the family history of PTSD, right? Observe, same thing with D, observe emotional and behavioral or developmental issues. That's all important. But because they've already witnessed an event, we need to get a referral to get them into some mental health counseling. Great. Number 4, which nursing intervention reflects secondary prevention for mental health?
Screening for depression.
What's secondary,
Screening.
right? So the correct answer is A, screening. What is B, primary, secondary, or tertiary?
Primary,
Why?
because they're teaching stress reduction techniques, teaching, educating.
Prevention.
Avoid it.
What is C?
Tertiary.
Tertiary,
Because
They
they're
already
reserving.
really
So
depressed.
they already have a
Depression.
diagnosis of depression, right? What about D? What's D?
They already have PTSD, so is that tertiary?
Tertiary. Yeah, they already have a diagnosis. Which nursing assessment is most important in clients abusing oxycodone?
I got this,
Yeah.
but it was apnea.
Yeah, it's a opinion.
Yeah.
What's the important word in the question?
Most important.
Most.
Abusing,
That would be their breathing.
Apnea. You're thinking ABCs here, right?
Mhm.
right?
Okay. Question number 6. There are several questions on your exam that are primary, secondary, and tertiary, which is why we're going through this in depth on the quiz.
So this one is C.
Which reflects tertiary prevention in substance abuse.
The right.
Tertiary. They already addicted.
So what's the correct answer?
C.
See,
C, right? Arranging addict-led support groups to promote recovery,
Mhm.
because they're already considered an addict. What's A?
Secondary.
Because,
screening.
You're
thank you.
screening.
What's B?
Primary.
That's
'Cause
primary.
Great. And what's D?
Screening. Secondary.
Could it be
Well,
primary?
Is tertiary?
I would say primary.
Helping parents role model adaptive coping.
Coping mechanisms, I can't even say it, for the substance abuse, right? So would it be, oh, no.
Oh, if you're gonna be a role model, wouldn't it be like primary because you're
Primary.
gonna be the
Yeah,
role model so they don't abuse drugs?
Yeah, it would be primary because you're teaching, helping
The coping method.
parents. Right,
yeah.
exactly,
Yeah.
exactly. Okay, if you didn't read your notes ahead of time for week 5, I'm not sure you got this right. Which nursing intervention reflects non-malfeasance?
I put
What's,
A.
what, do you
A.
remember what non-malfeasance is?
to do no harm.
Do
Do no
doing-
harm. Right, so A is the correct answer. Excellent, excellent. Okay, B has nothing to do with non-malfeasance, nor does C or D. So excellent, excellent job for the ones who got it right. Question 8. The nurse notes the client's pain is poorly controlled despite a fentanyl patch and the need for sublingual morphine. Which intervention is appropriate?
Notify the healthcare.
The doctor.
Why is that the right answer?
Because they're in hospice.
Exactly. Exactly. Does everybody understand that one? Number 8. Really important question. Number 9. The client tells the hospice nurse, I don't understand why God is punishing me. Which response is appropriate?
B, do you have a pastor I can call for you?
Yes, yes. You would never say A, right? I mean, this is where spiritual guidance comes in, right?
I have a question.
Mm-hmm.
What if they ask you to pray
Right?
with them? What if they ask you to pray with them?
Sure, sure, absolutely.
But we
And that-
wouldn't suggest to pray for forgiveness ever, right?
No, I mean, I guess you would use your best judgment. You wouldn't initiate that, but if they wanted to go there, it's all about therapeutic communication, letting them tell you what their needs are, right? And then the last one, a client with metastatic cancer has made the decision to stop all her therapies. Which statement by the nurse reflects a respect for the client's autonomy?
A.
Why is that the correct answer?
Autonomy, independent, so she, whatever she want to do, I mean, it's up to her. And if she needs some help, telling her family, then
Mhm.
we can help her with that.
And look at the other
You
3
ask her
answers.
for permission.
Yeah, exactly. Right? Let me see if the physician wants to talk to you about benefits. She's already said, I don't want any more therapies. And then why would you question her by asking her, do you think this is the best decision? And then D's inappropriate as well. Right? How'd you do? The ones you got wrong, do you understand why you got them wrong?
I'm kind of stuck on that one, the one I got wrong. I put,
Which
why
one?
do you think God is punishing you? Or why do you think you're being punished? I understand the other ones, why I got them wrong, but that one, of why do you think you're being punished?
Well, because I had this discussion last term with a class. Then you're the reason why that's not the right answer, is then you're asking them to speak about maybe their faults or their why they feel like they're being punished, and is that the most therapeutic way to have them communicate?
Doesn't that also bring us out of scope?
But-
Because you're asking a question that you have to have an answer to,
Yeah.
and
Right.
we're not really supposed to go into all that.
Open-ended.
Yeah, that's not open-ended.
Mhm. Mhm. Yeah. Yeah, good thoughts. Thank you, Rachel. Good thoughts. Okay, that's all I have for today. Hopefully this was informative and you're continuing to expand your knowledge about community nursing. We talked about a lot today. Please work on your HESI study guide. After today, we covered weeks 4 and 5. So now you have 5 weeks of information. So that's a really good chunk of the study guide, your HESI study guide. Anybody have any questions? I don't know if Alicia is still on here.
I
But
have a question.
yeah, go ahead.
Is our homework grades on? I know you said you were gonna turn them on. I wasn't sure if it was week 3 or 4.
No, I don't turn them on till week 6.
6, okay.
Yep.
All right.
Yep. And then I leave them on through week 7.
I have a question.
Mhm.
When I was doing the case study, it says refer to question 9, and question 9 said something, and then when I submitted the case study, it seems like I was supposed to answer to a different question, not question 9. You know what I'm talking about?
Mm-mm. I don't.
So I'm gonna tell you. So when I go to the case study,
The HESI case study? Okay.
it's question number.
I can't hear you. I can't hear you.
It's question number 7.
Okay.
Okay. And there you go. Just 1 second. It's right here. And right here. Oh, I'm trying to do view result. Yeah.